Three, two, one. Dan Blake, it is an absolute pleasure to welcome you to the Care Home Show. It's a very special episode of the podcast today, and I know that there's something really important that you want to be able to share with people today. So yes, Dan, welcome to the Care Home Show.
Welcome, Simon, and thanks for having me.
You're very, very welcome. So before we get into what it is you'd like to be able to share today, tell me a little bit about your background and how did you get into the care sector?
Yeah, sure. So my name is Dan Blake. I'm currently one of the co-founders of a company called Florence. My background was I first spent 6 years in the British Army. I guess the most interesting part of that was spending 7 months in Iraq back in 2005. After that, I decided to leave the military and spend some time working in big companies, financial services, before then moving to the care sector as a volunteer, working in a small care home in southeast London. About 3-4 years ago, I set up a company called Florence, and we help, broadly speaking, nursing homes find and book nurses and carers to cover rota gaps. And so and we've grown the business nationally, and so I spend every single day in the care sector now.
Got you. So firstly, thank you very much for your service, and thank you very much also for setting up Florence. Having had friends and colleagues that use the platform, I know how impactful it is. So great work on from that perspective. But that's not the main focus of the conversation for today. So obviously, at the moment, we're living in unprecedented times with the coronavirus impacting people around the world, not least of all, of course, vulnerable people. So one of the biggest challenges that vulnerable people are going to face is going to be around receiving care, receiving support, just generally having human interaction. And whilst there are scarce resources around because of the coronavirus, whether that be people or resources or whatever it might be, ultimately vulnerable people stand to not come out particularly well because of the situation. So to help address this, you've basically developed a technology platform called the National Care Force, which I must say sounds amazing. So please, can you tell me a little bit more about the platform?
Sure. So the National Care Force, it probably helps if I just give you a little bit of context as to what we do at Florence, so to help you segue into the National Care Force. So at Florence, we've taken, myself, I was doing some work in the care sector. My co-founder was working as a doctor, and we saw some of the inefficiencies and some of the challenges around the sort of agency staffing world. So we sat down and we decided, how could you do this better? And we looked at what else was going on in society, lots of adoption of mobile phones, people using things like Airbnb, Google, Uber. And we thought, how can we take those lessons and turn them into something that we can use in the care sector? So we created Florence, which is a technology-based business that allows nursing homes to find and book local pre-vetted nurses and carers across the country. And within that system, there's lots of things like machine learning to make sure you have the most appropriate candidates and some various algorithms. So myself and my co-founder and a few others got together over the weekend, and we were also pulled into a few kind of Department of Health type discussions about some of the challenges and some of the predicted challenges that are going to hit the health and social care sector in the next few weeks and months. And we thought to ourselves, what can we do that has the biggest impact? And the thing we thought that we could do to have the biggest impact was try to, free up resources so they can go and work where people are in critical need, i.e. probably in the NHS, where you'll see a lot on the TV. But without doing anything, I think if that happens, then the sort of social care sector gets neglected. People are focusing on, the NHS. So that will be in nursing homes, that will be in learning and disability homes, that will be in the community. So we thought, why don't we take our technology platform and allow providers of care to connect with local vetted volunteers to do tasks. And those tasks could be anything from, picking up the shopping, picking up a prescription, going to a nursing home to, make cups of tea, all the way through to actually providing some more medical and clinical services if they are qualified and if they are a nurse or a doctor. So that's what we're doing, and we launched it a few days ago, and we've had some pretty good traction. We've had about 5,000 people sign up.
Wow.
About 1,000 providers, and the first product should go live either tonight or tomorrow to allow those very basic functions to happen. So hopefully by doing that, we'll free up those people that can go and work in areas where people need more sort of clinical needs, and therefore we can get through this coronavirus pandemic as well as possible. Sorry.
Wow. I mean, I've got to say, firstly, I'd really like to applaud you and the team for coming up with the concept. I think this is going to make a massive difference. So thank you from that respect. I think one thing that the coronavirus has got me thinking about at the moment is how can we work? How can we work together? What can people contribute? How can we support each other? And I just think this is a great example of how technology can be used to overcome really big problems and ultimately be a force a force for good. So again, thank you for that. I think this is great news, and I think it's quite exciting as well, because it means that vulnerable people will have be able to receive care, to be able to receive support and just human interaction and things that are going to be very important to them. So yeah, good news. So
if I could say one thing. So I think the interesting part is, I think normal planning goes out the window at these times when you look at some of the forecasts. And I don't want to scaremonger, but public transport's probably not going to work the way it works. There's going to be at any one time a lot of people that are sick. With schools closing, that adds additional pressures onto the system. So I think this is a time where we not all need to just come together and rally around and support each other, and that will probably be at a local level. But we need to take some bold steps as a society to make sure that we get through this, and those vulnerable people are not just left neglected, because we are a developed nation and we need to look after our vulnerable people.
Yeah, I couldn't agree more with that. So I think it's really important, the fact that you underline that particular point. So thank you for doing that. So I mean, you've touched upon it a little bit, but who is it that's going to benefit from the platform? Is it just people that are in a care home environment, or will it be the wider kind of care sector?
Well, I think we've actually looked at the whole health and social care system. So I think, as I said, by freeing up capacity and resources at the sort of front line of clinical care, hopefully those people will benefit. But in terms of who are we serving, we are not looking to serve the NHS. We are exclusively focused on the social care sector, that often gets neglected, often gets, not as well funded, not as well publicized. So, if you are a care home provider, if you are a learning and disability provider, if you run anything in the community, if you're a local authority, we will have, the platform will be suitable for you to find local vetted volunteers to come and help you out.
And have I got it right that Care England is backing the platform?
Yeah, so we've been really fortunate. We've had a few people like that. So Martin Green has kindly given his support. Vic Rayner also has given us some support. We've also been very fortunate that we've had some pretty big like a big city law firm is helping us with some contractual stuff for free. So not only are we looking for not only are we getting volunteers that can do those really critical tasks that I talked about, but we're also getting volunteer people to come and help. So we've had a couple of people who are good developers to help us build the platform quicker. Mm-hmm. So yeah, we're getting a lot of good volunteering, and that's we're happy to take any more.
Yeah, definitely. Well, I mean, hopefully this podcast will be a conduit to that, to make people aware about what it is you're up to in the world. As I mentioned off air, I've got a couple of ideas around what I can do to over and above the podcast itself to raise awareness and get people signed up to the platform itself. So, what actually made you come up with the idea for the National Care Force? How did that kind of come to fruition, if you like?
Well, it's definitely not my idea. I'm very fortunate that within the Florence family, there's about 65 of us now. And I think about 7 or 8 of us got together on a last Sunday, and came down and we sat down and we thought, what could we do? And we have a very good technology platform, as I said, and we think this is the best way to have the biggest impact in the shortest time. And I think that's probably the other thing, is like time is very critical here. We haven't got time to wait for a big project or a big steering committee or something. We just need to get stuff and get it done quickly. So Yeah, I think it was a kind of a combination of many things. I actually wanted to call it the Royal Care Force from my military background, but
I like that.
but that got vetoed, and apparently you need to get permission from the Queen. So we probably didn't have time for that. So we've gone for National Care Force, which we think is pretty powerful as well.
Yeah, no, I like that. I like that too. I like the Royal Care Force, but no, National Care Force. It's got a good ring to it too. So, explain. It sounds like a pretty straightforward platform. Just for kind of avoidance of doubt, if you, how does it work?
Yeah, so there's two sides. So let's say you're a volunteer. You, at the moment, just go and leave some basic details, but as at tomorrow, you'll go through a very basic sign-up flow, which will include things like your name, where you live, some of the skills that you have, some of the training qualifications, and that's it really. And then there'll be a bit of vetting outside. And once you pass the screening, you'll be able to see local available tasks. And on the other side, if you're a provider of care, you will just sign up and you'll be able to list your tasks and how many people you want and the kind of skills you need. And it's effectively, it allows that care provider to have access to a pool of people in a very efficient way, and then them to connect together and sort of volunteer. So yeah, we're trying to keep it very simple, and we'll happily evolve it over the weeks. We've got a lot of people working on it, so if there's a particular need for a certain type of feature or a bit of feedback, then we'll definitely adapt it. We'll learn from our users and make it basically, how do we make it valuable for the end person we're trying to support, and that's what we're trying to aim.
As is important with the technology, with technology development, it's all about customer centricity, isn't it? If the more that you can focus on the end user and make their journey and the value that you can bring to them, the better. Then obviously that's where the magic kind of happens with this type of technology, of course, as well. So yeah, that's great to hear, and it will of course be an evolution. This is you've obviously got expertise and the underlying kind of technology framework and things like this, but bringing this type of new version of the platform to the nation is going to be no small task. So I can imagine you'll have people working around the clock to bring it to fruition. But yeah, again, it's great the fact that you're doing it. So how do people sign up if they're interested in either from a service provider perspective or somebody who's looking to be able to volunteer their time? How does that work?
Yeah, really simple. nationalcareforce.co.uk. That's nationalcareforce.co.uk. And just put in some basic details. It's pretty simple. It's the sort of thing that we're all used to doing now when we sign up for anything. So yeah, please sign up. Please sign up today.
Nice and straightforward. So okay, so from the perspective of the podcast, will go out. We'll try and get this one out just as soon as possible. So for the perspective of the audience of the podcast, what can people do? Obviously, people can volunteer. People can recommend it to service providers. Yeah, how else can people help? Because I think people are going to want to get behind this and try and support in any way they can.
Well, hopefully. So, and thank you for taking the time to have this conversation. But I think, ultimately what we're looking for is volunteers who can have time, and that time could be 10 minutes a week. It could be 10 hours a day. Any small bit of time is useful. And tell your friends, tell your colleagues, use WhatsApp, use Facebook, whatever. Just get it out there. And on the provider side, look, we are open to any provider of care in the country. We are specifically going after social care, not the NHS. So if you're in England and you're CQC registered, then sign up. You're the people we're trying to help. I guess the third pool of volunteers will be a little bit more, maybe like the head office volunteers, I guess. So if you have a particular skill in finance, social media, technology, marketing, operations, and have some time to spare, then we'd obviously like to chat to you as well, because this is ultimately effectively a community project for the community. We're just starting it off, but it's going to grow and it's going to become bigger, and we need people to help. So yeah.
Cool. Excellent. Well, look, I'm personally going to be sharing this with my professional network and my personal network. I will implore all of my audience to do absolutely the same. So Dan, thank you very much again to you and the Florence team for bringing the National Care Force platform to the country. Let's go out there and go and share it as much as possible. Let's try and get this as much traction as we can, so that ultimately vulnerable people will have the best chance of getting looked after. So thank you again, sir. It's good to talk, and I look forward to seeing how things transpire with this. I'm sure it's going to have a huge impact.
Thank you, Simon.
Very welcome. Thank you very much for joining me on the Care Home Show, and we'll no doubt talk again soon. Bye for now.